Norm, what is vertigo?
Vertigo, from my point of view, always means a sensation of movement and motion. And it doesn't make any difference if I feel that I'm moving or if the environment's moving. There's a sensation of movement. And then not only do we listen to the sensation of movement, but the type of movement. The more we hear that it's spinning, I'm thinking anatomically, is it the semicircular canals? If I hear the symptom that they're being pulled forward or backwards, maybe to the side, to the ground, I'm thinking a little bit different mechanism because there's other parts of the inner ear, utricle, sacral, that are involved in that, but they're all tied up in this sensation of movement. Whenever we hear this, it always requires an evaluation.
So you mentioned inner ear. What are some of the causes of vertigo? And I'm walking toward the inner ear problem. What causes vertigo in the inner ear?
Yeah, because it's the inner ear, what we do, again, we look at the anatomy. And that means it's an issue with the structures that are in the inner ear. And the two main structures are going to be the balance center and the hearing with the cochlea. And from a neurologic point of view, there's two separate nerves, the vestibular nerve and the auditory nerve. So when we talk about inner ear problems, that puts the disease process not in the brain or the brain stem, but within the ear itself, we're always listening for, are there auditory symptoms along with the spinning symptoms?
Okay, so the hearing would be the auditory nerve, and the spinning is the vestibular nerve. Is that correct?
Absolutely.
So what's going on?
Well, there can be dysfunction. Sometimes both can be affected. Sometimes it's separate, but it can still be an ear problem. When both of them are affected, then we have to listen to the story again. Did all this with hearing impairment as well as vertigo occur after a viral infection? If it did, we're thinking more a labyrinthitis.
Now, what's labyrinthitis? Does that mean it's in the same area?
Yes, because a labyrinth is a physical structure that contains the cochlea, the vestibular, as well as the beginning of the nerve. So that's a term that we use. But we also know some people may have a viral infection that only affects the vestibular part. We call that acute vestibulitis.
What's that like?
Well, that's all the terrible vertigo, nausea, and vomiting. It may last 2 weeks, 3 weeks, 4 weeks. People can be absolutely miserable with it. Typically viral. There's no specific treatment to cure it, but we try to treat the symptoms. And people are going to be very, very dizzy, vertiginous, spinning, no matter what they do, whether they're lying, they're moving. It occurs all the time. And early on, a lot of nausea and vomiting with it.
Is that a common symptom?
For acute vestibulitis, it's very, very common. But again, we're always looking for the story, are there any other symptoms with it? Because occasionally with just acute vestibular disease, it can be the first presentation of multiple sclerosis. But if it's acute vestibulitis from viral, typically monophasic, meaning one time. But if somebody starts having a second episode, separation, everything gets okay, third episode, then we're saying this person needs a further workup.
How do you treat acute labyrinthitis?
Many times this can be a bacterial infection. A lot of times illnesses that you may see with acute sinusitis that then go on, develop after 7 to 10 days, they're not getting better, then they start having a little pussy discharge and this and that. And so frequently antibiotics may be used for the acute labyrinthitis. For the acute just vestibulitis without auditory, antibiotics are probably not used as much.
Can you use motion sickness medications?
Sure can.
Dramamine, Marazine.
Absolutely.
And every medicine has its side effects. So when you take something, it may make you sleepy, and you have to go into all that with the patient.
Absolutely. It may help a little bit, but it usually runs its course.
What's benign positional vertigo?
This is, again, where the history becomes very important. As I said, with acute vestibulitis, they have the nausea, vomiting, and vertigo. Well, the people with benign positional vertigo also have those three symptoms, but it only occurs when they get their head into a certain position. We have a way, neurologically, as well as ENT doctors, of putting the people in these different head-hanging positions. We then look at their eyes. They frequently have a type of motion that's very characteristic of it, and based on the history of no auditory symptoms, only occurs with position, doesn't occur in every position. with the eye findings, we can say this is benign, and it's benign from the point of view that it's not due to a stroke, not due to cancer, not due to a tumor, not due to an infection, but it's not benign to the patient.
Not at all. There is an Epley maneuver,
Yes.
Which does something to something in the semicircular canals. I'm going to let you teach me what that is.
Yeah, absolutely. They have, there's just some therapists that have unbelievably great skills. These canals are oriented in different directions. And what they do is that they can tell by eye movement and some of the other problems which canal they think is causing the trouble. And the theory is there's a little stone in one of those canals. So what they do is position your head in different positions, and as crazy as it sounds, they're actually draining the stone out of the canal into kind of a drainage area, and it can be absolutely dramatic how much better people are after they've gone through these vestibular rehab procedures like the Epley maneuver.